Today was about preventing suicide. We've been planning it for about 2 years. We wanted to give our staff an opportunity to listen to some of the foremost thinkers about suicide prevention, and that's what we did.
Today's event is part of a much larger programme that the Academic Health Science Network have supported the funding of with Cumbria Partnership Mental Health Trust to look at suicide reduction across the whole of Cumbria. We have, with today's event though, widened the audience to the North East and North Cumbria.
Today is a really important day. It's a real wonderful mixture of international academic experts, practitioners and related people who care very much about suicide prevention.
I think as a nurse, you always are touched by, when you hear that people have sadly ended their lives by suicide. So it's both professional and personal really for me.
Well, one of the things that emerges in a conference like today is how many different factors are involved in suicide. And it's a complexity problem, and we've got to find all sorts of solutions.
My interest really came out of several things. I had a personal experience of a friend who attempted suicide, and it really made me think that we don't know very much, and so I began to explore it in a bit more detail in terms of research.
The biggest problem, obviously, with completed suicide is they haven't been in touch with services before. So it's a public health problem as well, and we've got to deal with the factors that make suicide more likely, as well as helping the people who we know are at particular risk.
We're really interested in finding out what are the key factors that lead to self-harm, and particularly looking at how those things evolve over time, which has been something that's been missing from the literature so far.
I was really struck by the fact that very few models really understood or tried to understand the difference between people who think about suicide and those who make the transition into attempting suicide or dying by suicide. So a key thing that my model is trying to do is better understand that complexity.
Our interest in today is thinking about Rory's IMV model, is thinking about what makes sense of why we can have 3,000 people who may have suicidal thoughts, but thankfully so few of them go on to actually take their own life.
We're looking at how we develop a suicide prevention strategy locally in the North East, and that's why I came. And I think it gave us a great number of ideas and give us some idea about what the evidence is already.
Well, hopefully they start to reflect on their own practice, how they might implement the research, and that's a huge challenge for us. How do we get our research into practice? How can it be used?
I must admit, we weren't sure how many people were going to come. There was people from all over the Cumbria area, from the North East, service users, third sector, so I think they got a really, really good turnout.
It was just fascinating, and they all seemed to fit so well together. I just thought they were really quite inspirational as a package.
I'm looking forward to learning from people I meet today, and both other speakers and other delegates. Really, really exciting day.